Hi everyone, I'm Tao. In this video, I would like to introduce a clinical decision support system for dementia to you. So what is dementia? Dementia is a condition in which cognitive function, like the capacity to process thoughts, deteriorates beyond what is expected with normal aging. It's generally chronic or progressive. Memory, cognition, orientation, understanding, computation, learning capacity, language, and judgment are all affected. The signs and the symptoms linked to dementia can be understood in three main stages. The early stage of dementia is often overlooked because the onset is gradual. The common symptoms include forgetfulness, loss of track of time, and becoming lost in familiar places. As dementia progresses to the middle stage, the signs and the symptoms become clear. The patient will become forgetful of recent events and people's names. It's more difficult to communicate with other people sometimes. They will need help with personal care. The late stage of dementia is near total dependence, and the inactivity memory disturbance are serious, and the physical signs and symptoms become more obvious. It's hard for patients to recognize relatives and friends. They will have an increasing need, having difficulty working and experiencing behavior changes that may escalate and include aggression. There are many different forms of dementia. Alzheimer's disease is the most common form and may contribute to 60 to 80% of cases. Other major forms include vascular dementia, dementia with Lewy bodies, abnormal aggregates of protein that develop inside the nerve cells, and a group of diseases that contribute to frontotemporal dementia, degeneration of the frontal lobe of the brain. The boundaries between different forms of dementia are indistinct and mixed forms often coexist. Worldwide, around 50 million people have dementia. The estimated proportion of the general population aged 60 and over with dementia at a given time is between 5 to 8%. From the dementia statistics of Alzheimer's Disease International, we can see that the total number of people with dementia is projected to reach 82 million in 2030 and 152 million in 2050. So why do we use DSS for the diagnosis of dementia? With statistics showing that 60% of dementia patients are not currently diagnosed in the early stage of dementia. MyDSS not only detects dementia at home with 3 tests in the mobile phone, but also improves the quality of care and health outcomes. It also reduces medical costs and diagnosis time and outputs a list of possible diagnosis and medical recommendations from the data entered. So the DSS mind map is showing below. It's split into 3 sections: users, input, and output. In the next slides, I will go through each of them in detail. For users, I have divided it into 3 parts: physicians, guardians, and patient care. For physicians, it has attending physicians, scholars, and researchers. For guardians, it includes family members. For patient care, it includes registered professional nurses and caregivers. The system allows the guardian or caregivers of an elderly person to take a sample home dementia test to detect the potential risk of dementia in the elderly person. The test results are used by physicians and nurses to check the elderly person's states and to provide treatment recommendations. Finally, all test results, personal data of the elderly person, and treatment recommendations will be recorded for the benefit of scholars and researchers conducting research on dementia. Now, we can look at the data input model, which has three types of data input. The first is patient information, including name, age, gender. The second is three awareness tests. The first test, the mini mental state exam, which is called MMSE, is a widely used test of cognitive function in old people. It includes tests of orientation, attention, memory, language, and visual patient skills. It's similar to the third one, the Barber dementia screening test, which is called BDST. However, the BDST is more suitable for old people who have limited mobility and are unable to complete the MMSE test. The second is the mini COG test, a three-minute test. It consists of two components, a three-item recall test for memory and a simply scored clock drawing test. If the patient is tested as having dementia, the patient will need to go to hospital for a multidisciplinary diagnostic screening program requiring a neurological, physical examination, cognitive testing, blood screening, and an MRI scan. Finally, an electronic medical record is generated for the doctor to make a diagnosis. This step is not required if the patient does not have dementia. So here are two examples of mini-COG test and BDST. Finally, after the assessment of the three test scores, there will be two results, one for not having dementia and one for having dementia. And the system will show which stage of dementia the patient is in. Depending on the condition, treatment is offered, such as medication, non-medication, and lifestyle modification, including a suggested medication schedule and a daily activity schedule, family companionship, and physical activity. The limitation of my DSS is that there are so many different types of dementia. My DSS only provides three initial tests to determine if a patient has dementia and at what stage, and gives initial medical advice. Further treatment requires data from the patient on relevant multidisciplinary diagnostic screening programs and the cooperations of the doctor for a more in-depth diagnosis. Here are my reference. Thank you.